Thanks for your time, sir. We appreciate it. I'd like us to start with the context. Now, Human Rights Watch says only 17% of the world's vaccines have been received by lower-income countries, which account for 47% of the globe's population. How does that compare to richer nations?
Well, clearly, the richer nations are way ahead in terms of vaccinating their populations. For example, in the UK or the EU and in the US, huge numbers have been vaccinated already, and also in Canada. Where we have the greatest need, the poorer nations, is where there is no access to vaccinations, and the biggest barrier to this has been the World Trade Organization intellectual property rights regime, which of course needs to be waived in order to ensure that there is equitable access to vaccines if there is to be a comprehensive and serious way of dealing with this global pandemic.
So you obviously reckon that this goes beyond sharing is caring, but how do you convince these big manufacturing companies to actually waive those intellectual property rights? Because they're not budging right now. We've had several leaders across the world asking for this.
Well, what needs to happen is that this has to happen within the World Trade Organization, where member states have the right, and we now know that there is huge support, including from the head of the World Health Organization, for the proposal by South Africa and India for this waiver at the World Trade Organization. The big pharmaceutical companies have to fall into line. The challenge here is that some of the richer nations, including the European Commission, are resisting and opposing this proposal to waive the rights. And also we know that France, for example, is prevaricating and not forthright in its support. We now know that the US government has come on board supporting this waiver. So that's a big boost. We need to get to a point where all the member states of the World Trade Organizations do the right thing to ensure global access to vaccines that is equitable. And the best way to do that is not necessarily through the global procurement process of the COVAX, where donations are made, because that's limited, that's very small. But it should be within the World Trade Organization with this waiver, and we now have broader support. More countries should come on board, and once that is done, we then look to Africa to say, some of the countries in Africa have the capacity to make vaccines. They should then be able to make those vaccines when that waiver is in place.
Yeah, South Africa is one of those places, according to our president, right? So let's talk about the overall picture in Africa and other poorer countries, though, because we haven't been able to get proper access to vaccines. And this is something that the EU and France in particular are opposed to, waiving these IP rights. So let's paint the picture. How bad is it? Because we know the numbers, but the reality is these first world countries are simply ignoring it.
Absolutely. And in fact, while we have first world countries like the UK now lifting restrictions and saying they have been able to control the pandemic and the spread of the virus, particularly because of the success of the vaccination programs, we also know that there is a huge spike in cases in countries like India, Nepal, Cambodia, Brazil. And we also know that in Africa, if you look at the numbers of those that have been vaccinated, including in South Africa, that's a tiny fraction of the percentage of the people that need to be vaccinated, including frontline health workers. So there is a huge gap, and we are saying as Human Rights Watch that it does not make sense for the richer nations to focus on their populations only, because you cannot effectively, combat this pandemic if you do not ensure that all populations globally have equal access to these vaccines. South Africa is, and other African countries are hugely lagging behind because they are largely dependent on the COVAX facility, which has got a small percentage that has been donated by well-wishers, by richer nations. We do not need to depend on charity. What is needed now is to ensure that the legal framework ensures an equitable access for everyone, for all countries, and that no one is left behind. Because, as we have seen, this virus spreads very rapidly, and therefore it would be foolhardy, it would not make sense for the countries in the West to believe that they have addressed the pandemic when it is raging in India, in Brazil, in Cambodia, in Nepal, and across Africa.
And lastly, I want to ask you about whether it's going to be too late, because we're starting these talks demanding that these intellectual property rights are waived so that we can produce it in other countries and not have issues. But the reality is there are thousands of people dying every day, right?
Absolutely, and that's the tragedy because, look, the call for the waiver, for the lifting of this property rights was made last October, and there has been, debate and back and forth happening since then. It is now time to act, and to act swiftly to ensure that lives are not lost unnecessarily and needlessly. You are quite right that every day that goes by without a resolution, without ensuring that there is this waiver, because after the waiver is secured, we need to then also look at building the capacity or ensuring that those 5 African countries that have got the capacity to produce vaccines, including South Africa, are properly equipped to quickly move into that phase. So it takes time. This is why we are making this urgent call to say this is the time for the World Trade Organization, for the richer nations like the UK, the European Commission, the US government, France, to show leadership, to save lives, and to ensure that we do not have unnecessary and needless loss of life.
Yeah, and in this instance, time means lives. That's exactly what it means here. Thank you so much for your time. We do appreciate it. That was Dewa Mavinga, Human Rights Watch, Southern Africa.